Let's talk about pericarditis. It's a really common cause of chest pain, one that sends a lot of people to the emergency room. So, figuring out what it is, and just as importantly, what it isn't, is absolutely essential.
So here's how we're going to break it all down. We'll start with the basics, then get into the signs and how it's diagnosed, look at what causes it, and finally wrap up with treatment and what to expect.
All right, first things first. To really get what goes wrong, we've got to understand the basic setup, the anatomy we're working with here.
Okay, so your heart doesn't just float around in your chest, it's wrapped in this amazing, tough, two-layered sac called the pericardium. Think of it like a protective case. Pericarditis is simply when that case gets inflamed. You see that itis at the end? That's just medical speak for inflammation. So the issue isn't with the heart muscle itself, but with its protective covering getting all irritated and swollen.
So how does this actually show up? How would you even know you have it? Well, your body gives off some very, very specific clues.
Now, pay attention here, because this is the single biggest giveaway. The pain is usually sharp, kind of stabby, and it can get worse when you take a deep breath. But the real telltale sign is the change with your posture. If you've got this chest pain, and it gets noticeably better when you sit up and lean forward, that is a massive clue pointing right at pericarditis.
It's not just about the pain, though. A lot of times there's a lead up to it, what we call a prodrome, where you just feel kind of lousy, maybe a fever, muscle aches, like you're coming down with the flu. And for a doctor, if they listen to your chest with a stethoscope, they might hear something called a pericardial friction rub. It's this high-pitched, scratchy sound, kind of like leather rubbing together, and it's the most specific sign they can find on a physical exam. Okay, so someone comes in with these classic symptoms. The suspicion is pretty high, right? But how do we actually lock in the diagnosis and be sure? That's where a few key tests come in.
The first and maybe the most important tool in the box is the ECG. It's a simple test, just measures the heart's electrical signals. But in pericarditis, it shows this really classic pattern of changes that helps doctors tell it apart from something way more serious, like a heart attack. And this right here is the brilliant part. In the beginning, you see these electrical changes pretty much all over the ECG. The key words are widespread and diffuse. See, this pattern reflects the fact that the entire sac around the heart is inflamed. That's totally different from a heart attack, which usually hits one specific part of the heart and shows changes in just a few spots on the ECG. So what's up with this number 60%? Well, it means that in about 60% of cases, another test, an echocardiogram, which is basically an ultrasound of the heart, will find something called a pericardial effusion. And all that is just extra fluid that's built up inside that inflamed sac. So once the diagnosis is confirmed, the next logical question is, why? Why did this happen in the first place? Finding the culprit is really key to getting the treatment right.
You can see from this chart that biggest slice of the pie is labeled idiopathic. That's just a fancy medical term that means we're not 100% sure what the cause is. But the general thinking is that most of these idiopathic cases are probably triggered by a common virus that was just never identified.
But it's not always a virus. As you can see here, the list of potential causes is actually pretty diverse. It can range from other types of infections like bacteria or even tuberculosis, all the way to inflammatory diseases like lupus, metabolic problems from kidney failure, and even things like a direct injury to the chest.
And all of that brings us to the final piece of the puzzle. What do we actually do about it? And what does the future look like for someone who's had it?
Now, this is crucial. Before any treatment really gets going, the absolute #1 priority is to make sure there isn't a life-threatening emergency going on called cardiac tamponade. This is when so much fluid builds up in that sac that it literally starts to squeeze the heart, preventing it from pumping blood effectively. Doctors are on high alert for things like really low blood pressure and bulging veins in the neck.
Okay, so once tamponade is off the table, the treatment can start. For the vast majority of cases, the ones caused by a virus, it's really just about managing the inflammation and pain with drugs like NSAIDs. Another medication called colchicine is often used too because it's great at preventing it from coming back. But if a specific cause was found, then the treatment is tailored directly to that problem, like dialysis for kidney failure or antibiotics for a bacterial infection. This chart does a great job of putting the risks into perspective. You can see that fluid buildup, the effusion, is pretty common, happening in about 60% of cases.
But the really dangerous complications, like tamponade or a long-term scarring problem called constrictive pericarditis, are thankfully way more rare, affecting less than 10% of people. And that leads us to the big takeaway here, the outlook. For the huge majority of people who get that common run-of-the-mill viral pericarditis, the prognosis is excellent. They get better with pretty simple treatment, and they move on with no lasting problems. For the other causes, though, the outlook really hinges on what that underlying problem was.
So we'll leave you with this thought. That very specific chest pain that changes when you lean forward, it's such a clear, direct signal from your body. It really makes you wonder, right? What other subtle clues, what other specific signals might our bodies be sending us every single day that we just might be missing? Listening to those details can make all the difference.